between two periods, before COVID and after COVID, without caring about COVID as a diagnosis. Thank you.
Thank you for a great question. No, actually, we did not include a patient diagnosed with COVID in that, or we did not specify if they have COVID or not, but we did study the comparison between COVID era before compared to the prior to the pandemic, but we haven't dig deep in whether they are diagnosed with COVID or not.
Okay, thank you.
You're welcome. Hadil, go ahead.
Hi, I'm a little curious about the literature reviews that you did in this study. Did you, the kind of resources, did you find any other study in the same area? And I'm just a little curious about that because of the, you know, the novelty of the pandemic and so on. Thank you.
You're welcome. Very, very excellent question, Hadil. Actually, I did, when we did the literature review, there were two papers were published at that time, and actually one from Spain, I believe, and Italy, with finding that suggestive increased number or percentage of depression. And another study from, I believe, from Africa, Ethiopia, I believe, or some of the African countries. So at that time, when we did the literature review, there were nothing about depression in, for example, depression or medication use in the US. But afterwards, there is another paper came out, I believe, but there were some similar in Europe and Africa, at least. Great question. Anyone else? Any other additions?
We can move on to next section.
Yeah, so next section is going to be the suggestions and ideas proposal for this year presentation. I think Green Team has new project led by Dr. Sarah Elsayed. If you wanna talk about the idea, Dr. Sarah. Sarah Elsayed, you are muted.
Thank you, Lubaba, for mentioning about our project. So actually, we prepared an abstract about the preventive measures taken in the primary care for healthy aging and optimum aging. So the abstract was reviewed by Dr. Nader and Lubaba and me, and as well Krupa. We've discussed about the potential modification and refining we can do in the abstract. So it was a broad topic about how multiple preventive measures to ensure optimal aging and healthy aging that we can do in the 20s and 30s. That was about vitamin D and nutrition, sleep hygiene, exercise, primary care, consulting in the clinic, and screening tests. But we thought about, we are a team now of 11 people. We thought maybe we can dissect this idea to smaller teams. Each one is focusing on a certain topic of all these primary interventions, primary measures. In that case, we will be all focused on the subject and on a certain side or corner of the measures we can take. Our aim is to try our best to submit it at the AMDA for an oral presentation. And we also want to take it to a step further and write the manuscript and publish it in one of the journals. That's it.
Great. Thank you, Sarah, for leading that project. It's a great idea. And actually, Sarah created a group in WhatsApp, and all of the members are very participating, and it seems to be a very promising and good project. If you have any questions regarding the project, reach out to Sarah. Anyone else has any idea that need to be discussed? Feedback about Sarah's abstract as well.
So I'll jump in here while people are, you can put your suggestion on the chat box while we going on, and then we take one by one. So if you look at the app, we added under your name, your picture, some tasks. One of them is a slide PowerPoint kind of file. In that file, you can download it to your device. And then it's just a presentation, similar to the presentation by Sulafa and Sarah, basically about healthy aging. So if every one of you look at that and see what the plans or what the idea is about. So I agree with Sarah. It's a good idea to touch and build a project around this area. If we can think ahead and how can we improve things for all people, and we should think about it in advance. In this day and age, we teach you in residency how you take care of patients for the time being. Let's say a patient comes with UTI or pneumonia. We teach you give this antibiotic for this condition or send them to therapy because of this. We try to fix a problem that's happening right now. But I think the approach is going to be different down the road, and we want to get involved into thinking ahead, thinking of advising patients about what down the road so that we can prevent it from happening. And this can be done not only for patient in the residency and fellowship, but even at this time in your home, in your family, in your friends' family. You can educate people around you about things that can be done to prevent conditions down the road. I will say just one example. I came to the US many years ago, and the first job I took was in the USPS, which is the United States Postal Office. We take packages, take it from one place to another. And the first day, what they did is they trained us about how to lift items, let's say a box, the right way, and then compare it to the wrong way. So if we did it the right way, we will be in the facility working there for many years to come. If we did the same lifting in the wrong way, then we will injure ourselves, basically back pain. And if that injury happened to you in a young age or maybe with age, it can cause more damage down the road if you repeat doing the same wrong method of lifting. So you will end up basically with chronic back pain, which is a very common condition in older patients. We see a lot of them with limitation of movement, with falling down, with chronic pain syndrome. And all of this can be prevented early on if we teach them how to lift things the right way. So I think if we focus on teaching people about the important things that they can do now to prevent things from happening 20, 30 years down the road when they become older, I think that might be a good approach. So thank you, Sarah, for taking the initiative and creating this project. So I want every one of you, if you can look at that file on the app, I think it's more than 50, 60 slides. You can skip some of them, but I want you to get the idea about how people think about healthy aging in the US, maybe also globally. Thank you. Do we have other questions?
Thank you, Dr. Nader. I don't see hands.
Can I ask a question? Sorry, I missed that. What is the CERES project? What is Dr. CERES project? I'm sorry.
Hello, Dr. Abdurrahim. So the project is mainly about the primary measures that we can take, the preventive measures we can take in our 20s and 30s, such that we can have a graceful and healthy aging. This is the main project. So it includes, like, as Dr. Nader mentioned, like how we can do like the precautions while we are like for heavy lifting and protect our protect ourselves from injury. As well, like it also there's another idea that such as like sleep hygiene, the counseling we can do during our the annual visits for proper nutrition, proper sleeping, what are the best the lifestyle they can do, how they can watch for their nutrition, so that like they can have like graceful aging, such that like maybe in 10 or 20 years the geriatric population will not be as vulnerable as they are during like what's happening like these years, particularly like in any case of like health emergency or health crisis like the COVID. They will not be as high risk population or at less risk than what happened during the last year.
Thank you. Thank you. And I want to comment to Nader. Nader, you have said you have come to United States many years ago. What do you mean? You don't need to answer, okay?
That is okay.
I think we need a written consent to share such information.
You have to go through the RP.
Okay. Anyone else? Any idea that, guys, you need to discuss more? I attended last week meeting, and I really like Dr. Abuzer's suggestion, studying autopsies. I believe if you have any updates regarding that, Dr. Abuzer, if you want to share with us.
Assalamu alaikum.
Alaikum salam.
Do you hear me well?
Yes, go ahead, please.
Yes, I have a great update regarding what I discussed last week. So, as Dr. Nader suggested to me, I went and I talked to my supervisor regarding my research interest. They were very welcoming and excited about the ideas and the research interest. And even I found one of them. She has. Do you find any difficulty hearing my voice?
No, go ahead. I can hear you. Do you guys hearing him?
Oh, great, Abuzer.
Continue.
Okay, yeah, okay. All right. So the chief deputy, she has interest in conducting research as well. And we discussed all these together, and we can share one project together as she suggested to me. So we ended up having like 3 ideas. We have to choose one of them, or we can conduct all of them if we have the time for that. The first one is, she said that she has seen a lot of homicide related to illicit drug use. So she want to, she want to study if there is any relation between illicit drugs and homicide risk. She meant those who involved into homicide, were there any drugs or toxins in their blood before the homicide or suicide? And the second idea is homicide among a specific race. We have seen a lot of, unfortunately, Black African American homicide. Like if we had 10 per week, 9 of them will be Black African American. So she suggests we might do a study on homicide among race. Or the third idea, she suggested that we can track the homicide cases using zip code, so we know which part of the city has the most homicide rate, so we can come with educational programs or ideas that can help that community who has a most homicide rate. This is our three ideas. So she told me about them and she asked me to choose one of them and we can start next week. She also mentioned that she can provide with any data that I need, any kind of data. She has data from 2016 until 2021. So I have free access to every data I want, but my issue is that I don't know how to start, what idea I have to choose, or how to start, which idea, and what study to use. So I'm sharing this with you guys to help me and guide me. And thank you.
Thank you, Dr. Abuzar, for that's really great news. So we have another area to work with. So I think Dr. Nader, if you want to comment about another attending will be included, and go ahead, please.
So let me ask you where you're located.
Indianapolis, Indiana.
Indianapolis. Yes. Okay. So this is great. I really I like the good news that you approach your supervisor and she is excited, and also sharing the three ideas. Thanks for that. So a couple of questions. One of them is how free time you have, number one, and that depending on if you have enough time, you can handle the three ideas to create three projects at the same time. If you are busy, that's another situation. So you can prioritize which one of them is number one for you. You think might be of interest and might be of use for you and the community. So I will handle it as if you have some time to handle the whole three projects. Let's take that route first, and then we jump to the next. If you want to tell her that I'm interested in the three projects, and I have team of fellows who are here in the US and also in other countries that they can help me. And by help, I mean you create a team. You will be a leader, let's say in project number one, or maybe in all of them, where you assign, see who's interested, let's say 5 or 6 fellows in the first project. So you assign them tasks and you work with them in that project. So one of them will be doing literature review, one of them will do the type of the data or the methods. One of them will be writing the abstract, and then maybe one will or a couple will approach seminars or conferences where they will present this. And so they will identify which meetings, conferences they can present this project to. If you want to stretch it, maybe you can also assign 1 or 2 to identify journals where you can write this as an article or manuscript and submit it to be published as an article. So this is for project number 1. And you can do the same for project number 2, project number 3. You identify who will be interested in these projects and do the same approach, like the team approach for each project. It may take some time from you initially, but down the road, it will be like easy if each one individual in the team has a task, an assignment, and they do their best to complete that by certain deadline that you can assign them to do. That's one approach if you are enthusiastic and you have some of the fellows who are interested in the same area and do the work. My suggestion though is if you want to give it a flavor, because we are only in geriatric, you can look at this data and compare the age. So you compare, let's say, older adult versus young, and in each project you do that so that you will be running the 3 projects according to what we are doing here, unless you want to do it just for your sake of learning the process. That's something different, but to make it related to what we are doing, I think if you add some stratification or categorization, you identify your subjects and divide by age and see. Maybe you can find some older patient there, maybe you cannot. If you can't, that's well and good. The other approach, which is if you are busy and you don't want to handle everything, then prioritize your interest with which one of these you think is beneficial for you, can be done, and beneficial to the community around you, if you want to be recognized for that as well. If you do that, select one, and keep in mind, you can tell her that we have the fellowship, we have some people who might be interested in helping you with the other project. So you can just make it available for the fellows who is interested can join or speak to that supervisor, and they can carry on with project number 2, project number 3, the same way you will do the first project that you are interested in. The steps, as I said, create a team, and then you want to do the idea first, and then the variables, what exactly you want to collect. As she mentioned, maybe you want to look at the levels and the groups or demographic. So you identify what variables you want to collect, and the method will be just reviewing the charts. So it's going to be retrospective. If you have all this written, then you can take that to the IRB in your institution, write it as a proposal for a project, and then they will either say yes, approved, or expedite, or they may say maybe we need more information. So you just reply to their questions, and after they approve, then you go ahead and start collecting your data. But basically, you're gonna use a spreadsheet, Excel or SPSS, adding your data, and then think about how we can do the analysis. If you have someone who can help with data analysis, that's well and good, or at least by that time, maybe you can, or your team will be learning some of the SPSS and they can do the analysis themselves, if it's basic things. And if you are at that point, then you will be ready to submit your project as an abstract to a conference, or you will be ready to turn it into a manuscript with your team, and you can submit it to a journal. So I think it's a good approach, good steps, and great work. So think about it and let us know. If you need any help, we'll be available to help as much as we can. And, thank you.
Thank you so much, Dr. Nadir, for your input. I will definitely tell her about your suggestion that I have any fellows that might help if you agree with that. And I will let you know next Saturday about the result.
Sure.
Okay. The other thing, I'm doing a full-time job and it's kind of busy, but it would be great if I can handle all of them together, 3, because I have nothing is published before in my resume. So I will try to handle all of them together. I will try to do that with help of you and other fellows if she agrees about that. And the other things, do you think that we should care about IRB because we are doing that on cadaver or deceased or dead body? So do we need the approval of IRB, or as Dr. Sarah mentioned, if we are doing something in cadaver or deceased, you don't have to take approval from IRB. Is that correct?
So it's kind of a tricky question because the data you are collecting might have some information about these patients, and if you remove the identification from the data, then I think you will be safe. So I would suggest that you discuss this with your supervisor and see if you have an institution where you have an IRB. Maybe you can also call them and tell them, hey, we plan to do this. Do we need to apply for expedite or exception? And then they can tell you yes or no. If they say you are accepted or you don't need to go on then that's fine. You saved your time. Thank you.
Okay. Thank you so much. So next week, inshallah, I will be having answers to your questions and your suggestions. Thank you for your input.
Thank you so much, Dr. Abuzar. Good luck, and we are looking forward to hear more about it next week. We have Selma Ali, followed by Wiam Osman and Hadil. I hope I choose the right order. Selma, go ahead, please.
Assalamu alaikum, everyone. Dr. Lubaba, Dr. Nader, thank you so much for sharing your ideas and presentations with us today, and everyone else as well. I have been sort of just like toying around with a research topic, and just trying to find what literature review there is. And it's basically elderly abuse, and specifically geriatric providers or family practice internists. It could be in clinics, hospital settings. How many of them are actually screening their elderly patients coming in over 65 for abuse? Are you using screening tools? How many of them came back positive? Did you pursue it further? Because you know, there isn't, when going through the lit review, there wasn't much published data on that. I feel like safeguarding elders from abuse is sort of the same as with safeguarding children. Not a lot of research has been done on it. It could be fear, it could be a lot of factors, but basically we have around 5 million Americans abused annually in the US, but only 1.4% are actually reported to APS. So the question is why? Is it the providers are not screening? Is it is it the patients, and do they not self-report? So that's sort of what I'm toying around with right now. And I wanted to know your input and Dr. Nader's input as well. And anyone else's would be appreciated. Thank you.
Thank you so much, Dr. Selma. This is really great idea and great topic. And you came back with your statistic as well. So it's really very convincing area to study. I think Dr. Nader will speak more about that area regarding which direction you should pursue. This is really great. Excellent. Go ahead, Dr. Nader.
I agree with you. It's an excellent idea. Thank you so much for sharing. And again, it depends on how far you want to go into this. This is a very infant area you can explore a lot. So I think what you can do is you can identify how far you want to, or how much limitation you have to do your project. So if you want to approach clinics, for instance, it will be just the outpatient. So you identify a localized area, and then maybe you can approach these clinics and see your variables, what you want to say, for example, how many times do you screen an older adults? And if you have access to the records, how many times that was done? And if there is a protocol, what kind of protocol to do that? Let's say in older adults, we see them annually for annual visit. We're supposed to screen them for depression. We screen them for falls, for instance. Do they have that in their algorithm of screening? So you just tick, 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 and then say, we interviewed or we approached this number of clinics, and this might be a good option for quality improvement. So we looked at the chart, we looked at the guidelines, and we looked at what the protocol in these clinics, and we come up with these numbers, and then you can just publish that as a poster or as a paper. But it's a good idea. Thank you for sharing.
Thank you.
Thank you, Dr. Selma, and thank you, Dr. Nader. Next, Wiam, go ahead, please.
Yes, thank you for taking my question. Actually, my question was for Dr. Abu Zar Al-Khazin, but I want to comment on Selma's project or idea. I think it's a really great idea. And what I'm wanting to say is from a perspective of a co-patient, because my mom is what now, 65 or 66. And whenever I take her to her PCP visit, the WellCare, or like, you know, the follow-up, they will ask her these questions. Do you feel safe at home? Is anybody abusing you? But my other question, or actually I was so curious, like if I am with her in the room, you know, and just God forbid, like, you know, something like this happened and someone was abusing her, and probably, you know, somebody close to her, she's not going to be able to answer this question. So I was thinking, like, if there should be a better protocol for screening for this this elderly abuse, like at least they should give her a chance to be by herself with her provider or with the nurse to be able to answer this, and not be with her co-patient, which is like her caregiver, basically, you know, to answer this question. Maybe it's not my case, but like somebody else was actually being abused by their caregivers, they're not going to be able to answer this in front of the of their caregiver and the provider. So there should be a better protocol for screening for this, I think, from my point of view. So but that's a really interesting subject, Dr. Sarah. My original question was for Dr. Al-Khazin.
Can I interrupt you just for a second?
Yes, sure.
Just keep that in mind, your question for Khazin. It's 4 o'clock, so for those who have some other obligations or need to leave, step out, that's fine. The meeting is recorded, so whenever you have a chance, you can come back and review or look at the videos to catch up with what we are gonna talk in the coming few minutes after 4. So thank you so much. Wiam, you can ask your question again.
Yes, my question for Dr. Abu Zar. From the last time, because I think you shared the idea for the last presentation or the one before, and your main idea was basically, I think, overdosing. Overdose with drugs, and this is like the main reason for that. But this bring me to, I was so curious to know what is the information that is you guys put in the autopsy report, like the main thing, like what is the other information that is provided in the autopsy report that can be linked to like your research? Those new 3 ideas that your supervisor was, telling you about. Can you share with us just briefly, like the actual autopsy report, the main thing that you need to report in that after you do the actual autopsy?
Thank you, Dr. Wiam. Thank you for the question. So what we are doing after the DPT goes out is they get a call. There is a decedent in that area. They go out and take detailed history, physical examinations, and everything, and they bring it to the coroner office. After that, every day morning, doctors have meeting together and they allocate cases. This guy goes to for full autopsy, or this goes for partial autopsy, or whatever they allocate. After autopsy, we draw blood sample, vitreous and urine sample, and we send all these to the lab. And we draw histology as well and send it to the lab. And we wait for lab results to come back, and we decide after that what to put in the report. Like if we send blood and we give them a brief history, these guys had history of drug abuse, history of illicit drug, history of alcohol, and we found him dead at his residence with drug paraphernalia. So we wait for the result to come back from lab, and they will give us a detailed result. Like we found ethanol, say 0.2. We found cocaine, like 0.3 milligram. We found heroin. We found whatever they found. They write in a detail, and they will send the result back to us. After that, the doctors decide if the amount of drug found in his blood, it is a lethal or it is not. So if it is a lethal, they will sign the report that, okay, this is a drug overdose death or accident drug overdose, and they will make the report regarding or based on the lab result. So I hope that answers your question. Hello?
Yes, it answered partially. So, like, can you compare these drugs with other information, like the time of death, the location of death? This is also in the report, like where he was found, like where he lived, and all this, information also is also included in his report, or
Yes,
this is in the police report?
No, this is all included in the report. So the report is started from the call for the office that, okay, if a neighbor or someone called the office that, okay, there is somebody dead on his residence or on the street or whenever, there is a team called DPT. They go to the scene, investigate the scene, they document everything, the decedent, the scene, the place he died on, the circumstances around, and everything. Then they will bring him to the office, and we have access to hospital if we want to have some like medical records or any police history. We have access to hospital, we have access to law enforcement agencies, so we can collect every data that we want and that might help us to find out the report. So yeah, we include all demographic, social, and every history and physical signs that we found, plus the lab results that come back from labs that we sent toxin for.
Yes. Yes, so this is actually like you have everything you need for your projects. Even if you decided to pursue all three of them, you have access to everything that you need, because you can compare anything. You can compare the age to the type of the drug that they use, like for anything. You can compare it to the location. So this is I think this is going to be a great chance, a great project that you're working on, because the data is there and the report is there, and you have access to extra things even if you want to study further. And maybe you're going to have the chance also to publish this. I wish you really good luck on this. This is a great opportunity.
Yes, we have access. We have access to everything, and even we have data from 2016 until now. So my issue is what to choose. Like in 2021, choose from January to June. These questions might be to Dr. Nader if he is there. So
one thing I can suggest to Abu Zar and then to the fellows, if you want to write down the three proposal or the projects, and if you can add this to the app, if you go to the app, there is an icon, the three lines on the left upper corner. If you go down, you will find projects, and if you hit on the plus sign, you can add this as three separate projects. Put your name as the project leader, or if you want to assign someone to be the project leader. And for each one of the other fellows, when you click on this project, you can have the option to add yourself to that project, or maybe more than one project if you wish to. So by that, you will have your teams, Abu Zar, under your project number 1, project number 2, project number 3. And then what I suggest is you create a WhatsApp group where you can discuss the project number 1 with your team, project number 2 with a different team, and then project number 3 with a different team. In your discussion, then you will go into the details as you were just trying to go ahead. Sorry, I interrupted you, but if you want to look at the variables for the first project, you can decide what you want to look at with your team. And if you agree, go ahead and then collect that variables according to the proposal or the method that you want to do. And that goes for project number 2, project number 3. And this is just a way of organizing the steps for you. And it will be easier when you are working in teams because we have a big number of fellows. It will be chaotic for everyone to contact you personally, and then you reply to them personally. Maybe you will have the same question from different people. But if you organize yourself into teams and you select a way of communication, then everyone in the team will be up to date on the same page. And then if they have suggestion or next step, they can talk together and you can update them at once. Thank you.
Okay, thank you, Dr. Nader. I do agree with you, but my concern is that I have to take the permission from the supervisor first. As I mentioned before, this is governmental institutions, and they might not feel comfortable disclosing this information to the others. So after I take a permission, I will be happy to add this in the app, definitely. So next week I will talk to her, and next week I will talk to her, and I will let you know about that. Thank you for your suggestion.
Excellent. So we can move on. I think there are more people raising hands.
Yeah, perfect. Thank you so much, Dr. Abuzar, Dr. Wiam, and everyone for your inputs. And we have yes follow-up from Selma regarding her project. She was talking about she want to know that abuse comes in many forms and not necessarily physical. So verbal and neglect are some of the elderly abuse as well, and some of the elderly people, they don't know even neglect is considered as an abuse as well. That's absolutely true. We agree. I have Shima Al-Junaid.
So before Shima, I want to add one comment for the subject that, or the project that you just mentioned about elderly abuse. So one point also you want to raise in your variables is what they do or what they don't do, like if they have a protocol. And then in that variable, you will say in one clinic they do this, in different clinic they don't do it, or they do something different. I will give you an example. In here in Lansing, we have a senior clinic where they see older patients. In that clinic, what they do, if the patient comes with a caregiver family member, what they have a social worker or a nurse where they can go over, let's say, some items. So what the physician will tell the patient and the family member is that, can I take the family member to talk to the social worker about, let's say, cooking or whatever? Then they will be in a different room. At that point, then the nurse will come and talk to the patient, or the physician will ask the patient about abuse and so forth. So it will be in separate room. But that also depends on how your team and your setting and your protocol. But that's a great thing. Thank you.
Shema, thank you, Dr. Nadir, for the addition. Shema, go ahead if you hear us.
Yeah, thank you, Dr. Nadir, and thank you everyone today for sharing your knowledge and great information and suggestions as well. Actually, my question was to Dr. Abuzar, but it's similar to Dr. Wiam's question, so I think I received the answer. And I agree with Dr. Nadir, it's much better to discuss it more in detail within groups. So thank you very much.
Thank you. Thank you so much. Yes, Dr. Abuzar, we look forward to your updates regarding the projects. Go ahead, Sarah Sayed. I don't know if this is from previously or you raised your hand.
No, I raised my hand. Thank you. Thank you, Lubaba.
Mm-hmm.
Just I have a question about the research about the preventive measures project. So I want to know Dr. Nader insight if the topic, so the method we are counting on is literature review on previous studies, either both like human models or animal models, depends upon the available data. But I want to know your insight if it can be presented as an oral presentation or as a poster presentation in the conference. Because we plan to submit it for the AMDA conference in Baltimore, and we want to meet the deadline constraints. But I want to know, my initial plan was to have an oral presentation, but I received feedback that it should be rather as a poster presentation. But I need to know your insight about this point. Thank you.
Excellent question. Thank you, Sarah. So basically, the difference between both of them, the poster versus the oral, I think is the likelihood of acceptance at the conference. And to increase your likelihood for you to be accepted in the form of poster or oral, I think the first thing is to look at their agenda or their highlight. Each year, they will focus on certain topics and see if your topic matching these areas. That will decide if one of them is prevention and yours is prevention. This will be matching perfectly. If that's the case, then I would say go ahead with submission as an oral presentation. If it doesn't match the criteria or the goals or the mission, something for this year, then I would suggest to go for poster. Poster usually is easier to be accepted if it's a good quality and good area, and sometimes explore things that they did not do in the past, and good for the AMDA itself. So it's a homework for you to look at what they focus on for next meeting and see if that match. If yes, go ahead with oral. If not, then I will go with the poster submission. Thank you.
Thank you so much Dr. Nader. This cleared so many things for me. I appreciate that.
Thank you so much, Sarah and Dr. Nader. Anyone else had an addition, or should we suggest next week's meeting agenda? So today's meeting was sponsored by the Green Team. Next week is going to be, I believe, blue. Do we have blue?
So Khalid Osman, I think the leader for that team, he's not present today, but I think he can look at the video and the team can approach him. If you have questions, please let me know. I put some suggestions here. One topic we will be looking at the research population, how to select your criteria for inclusion, exclusion criteria, so forth, and how you can come up with variables for your study. In Abu Zair, for instance, we said maybe you can look at the age and the geographical area, the zip code, and so forth. So this part one. Part two, maybe some will talk about research gate and research in Google Scholars. So if you can just touch maybe 5-10 minutes about how we use with the benefit of research gate, how to become a member there, how to improve your presence in the research community, and add that also, add to that research through Google Scholar, how to analyze things using that tool. So these the two areas. And then for the tutorial, we can go ahead also with some SPSS, maybe touch on how to import data. Let's say you have Excel sheet, you want to import that into SPSS, or maybe text file, comma separated or tab separated files that you can also upload to SPSS and then take the information from there, analyze that. And the last part, maybe someone can show us how to do some of the basics graphs in Excel. The difference between the graphs in Excel and SPSS, the graphs in SPSS is very primitive, and the colors are very limited and kind of not cute, not sharp. What I did in the past is I analyze and get the graph and the data for that graph in Excel, in SPSS, and then transfer the data back to Excel and create the Excel graph, which is, you can get very bright colors, shapes, and so forth, and it will be easy, manageable when you present it. Let's say you want to put it in a poster or something like that. So these are the areas that I think we can talk about, and if Khalid or one other member of the batch one can present some of the projects in the past as well, that would be great. Thank you.
Thank you, Dr. Nader. I see a message from Dr. Mohammed Elfadil. Oh, go ahead. You want to mention it yourself? So he will be presenting next week. Go ahead, Dr. Mohammed Elfadil.
Assalamu alaikum. Just wasn't Sure, if you saw my text message in the chat. So I will present the research population and variables, if that's okay with the Blue Group members.
Okay.
Thank you.
Sounds good. Thank you so much. So agenda for next week is going to be research population and variables, ResearchGate and Google Scholar tools, briefly about SPSS tutorial and Excel graphs in Excel. So Blue team, if you wanna distribute this among you and provide us with knowledge next week. Dr. Mohammed Elfadil, go ahead.
Assalamu alaikum. Yes, good evening. Good morning. My question for the next, my suggestion for the next meeting. Thank you very much for the interested meeting. And for the next meeting, what about like we talk a little bit, like 5-10 minutes about the research career in the future, in the near future. It would be nice, I think, so we can get more idea. Thank you.
Okay, thank you for the suggestion, Dr. Mohammed Elfadil. We can keep it in our mind if time is going to be an issue. Actually, there was a previous suggestion from Hadil. I think she had to leave the meeting, but she was talking about if we can talk about rephrasing and citation when we spoke about copyright and plagiarism. So if someone will be interested in presenting that as well, not necessarily need to be next week, but those two ideas, we can keep them in mind. Any more addition? Other suggestions? I think we lost Dr. Nadir. Oh, he's here.
No,
Go ahead.
I think Mohammed Elfadil raised a very good point, and we will discuss this in the near future. So maybe we should add it to one of the coming meetings. I would suggest also maybe we should ask those who are in the research area to contribute to that in the future also. So thank you.
Yeah. Thank you, everyone. If there is no more addition or comments, we can call it a day. And Dr. Mohammed Tijani, is this from previously or?
No, this is a new question.
New question, go ahead.
All right, thank you everybody. Thank you, Dr. Lubaba and Dr. Nadir and everybody participated today. I'm afraid this can sound like a dumb question, but I just wanted to ask because at some point I felt like I'm a little bit confused on how these research going to work. Because what I understand it before, that each one of the fellows supposed to come up with their own research project and then works throughout the year to finalize that research project, which can be either a research or a review or anything. But what I'm just seeing today that people come up with good, very brilliant ideas of research, and they start recruiting others to work with them on that project. So kind of just clarification here would help to at least to decide what, or at least to plan for which line I will stick to. Thank you so much, everybody. Thank you for taking my question.
Thank you, Dr. Mohammed Yani, for the question. And I think as far as I understood and what we did last year, per year, at least you have to have one project that you work on, not necessarily be your idea. But Dr. Nadir can further discuss that. Thank you.
Thank you, Lubaba, and I agree with Lubaba completely. Basically, what we want is a project completed. If it's yours or if it's someone else's ideas, it doesn't matter. What we want is we need you to know the steps of completing a project from the start to the end. You may jump in the middle, but at least you will have some background of the basics, how we come up with the idea, the research topic or question, and then how we develop the design, what study, and then how we collected the data, how we analyze and then present as a poster or complete as a manuscript. So if you come up with the project yourself, that's well and good, and maybe you will be the project leader for that project, and then you can go over these steps from the start to the end, which is what we want you to learn. If you don't have an idea about a certain project, or you saw one of the ideas there discussed and you are interested in joining one of these projects, then you approach that project leader and then you join their team. And by doing that, you can complete that project and it will be counted as your completed project. You can jump as much as you can in more than one project according to what area of interest and how much time you have, so that you can contribute to the teams of these projects. The more, the better for you and for the group. But at the same time, we don't want you to commit yourself to many and then you don't contribute. So this is basically what we look for. We want you to accomplish at least one project. It doesn't have to be from your ideas. If you bring an idea, that's well and good. If you don't, that's not a big problem. You just join another team and then go from there. I hope that clarified the question.
Yeah, excellent. Thank you so much. Thank you, everybody. Thank you, Dr. Nadir and Dr. Lubaba.
You're welcome. Thank you. Anyone else has a final addition? Or I don't see any raised hands. And thank you so much, everyone, for attending, and looking forward for next week, and enjoy the rest of your weekend. Thank you. Goodbye.
Thank you, Lubaba.
You're welcome.
Thank you, everyone.
Thank you.
Thank you.
Thank you so much.
Thank you,
everyone.
Thank you so much.
Nadir.
Thank you.
Guys, have a good weekend.
Mommy, please can you shut? Mommy, open.